Welcome to the Igniting Impact podcast, brought to you by Public Knowledge. I'm Stacey Moss, the host of the podcast and the president of the management consulting firm. Our firm's vision is to be a catalyst for change, leaving each person, project, client, colleague, and community better than when we started. The Igniting Impact podcast is an opportunity to share with you what our clients do daily to impact our world. We want to highlight this essential work and the work that they do for their customers and stakeholders that is changing lives, despite the many daily challenges that they face. On today's episode, we have two guests with us, Ralph Choate and Ron Puent. They are here today to talk about Colorado's CBMS project. But I'd like to actually start with getting to know you both a bit. So if you could tell us a bit about yourself, what you do for work right now, how you got there, who you are outside of work, and what values that you live by. And we'll go ahead and start with you, Ralph.
The short version of the story is that I found myself after the age of 50 looking for a career that paid in the heart. I had had a successful 30-some-odd-year career in financial services and actually sold an interest in a 1,100-person call center operation and went to work for a public services company that had 11 people in a call center. I also earned both of my college degrees after the age of 50. My second is a master's in gerontology, which gave me a language for what I do now. In gerontology, we talk about the idea of encore careers, people who find careers in the private sector doing a wide array of things and then find in the later stages that they want to leverage all of that time and energy into something that is worthwhile for public service. And so 3 years ago, I joined Colorado as the Chief Operations Officer here for the Medicaid operation. Before that, I was the Medicaid Director for the state of Montana. So it's been an eventful career in those kinds of things. It's taught me how to learn to find your career in your heart, not necessarily in your head or your pocketbook. When you talk about the influences outside of the work, not only am I celebrating my third year here with the state of Colorado, but my wife and I just celebrated our 40th wedding anniversary. And so somehow I would contend that those successes go hand in hand.
What values do you live by and what drives you? And this could be inside or outside of work or both.
This will help date me, but I was actually a bicentennial Eagle Scout. So at some point, trustworthy, loyal, helpful, friendly, courteous, kind, obedient, cheerful, thrifty, brave, clean, and reverent are so indoctrinated into your head that the whole idea of that program is that you learn those values and then you live them. And the fact that I can still quote the 12 portions of the Scout Law after 55 years of being since my first scouting event. But it really does come back to that caretaker view, and whether it's caring for my staff, providing care for those in our state who are less fortunate. There is a philanthropic bent that has been a part of my life and my family's life for as long as I can remember.
That's great. Thanks so much, Ron. All right, Ron, you want to introduce yourself to us?
I'm a management consultant at Public Knowledge, and I might approach this a little bit differently since I wanted to congratulate Ralph on being an Eagle Scout. I have 2 Eagle Scouts myself, both of my boys, and so that also kind of feeds into my values and the public service area. It also, I'm taking your question completely backwards because all of the activities we did with our boys as Eagle Scouts when they were young really brought us into nature and, all the backcountry stuff we get to do here in Colorado. And so my wife and I still really enjoy doing all those kinds of things, hiking and biking and camping and skiing here in Colorado. And then as far as where I came from and what I'm doing, I started my career in Atlanta, Georgia, and came out here to help run the Medicaid system in Colorado. I worked for ACS, which became Xerox, and we were the fiscal agent for the state of Colorado. I had several different roles on the project. I started as a software developer, moved into systems management, actually set up the first PMO that we had here at the state of Colorado as the fiscal agent, and ended up my career there as an operations director. So got to learn a lot about what Ralph was just mentioning with call center and a lot of the groundwork that goes on in fiscal agents. And so 5 years ago, I joined Public Knowledge, and I'm a management consultant here, and working a lot of projects, helping the state of Colorado, and then thoroughly enjoying it, and thoroughly enjoying working with Ralph as well.
Great. Thank you so much. Thanks, both of you. I had no idea we were going to be talking about Eagle Scouts, but I love it. I feel like I should have gotten my boys into it. I did not. It's not as big, I don't think, where I'm at. All right. Well, let's start with just having you guys tell us just a bit about the project that we're here to talk about. So I'm referring to it very shortly as the Colorado CBMS, but if you would help explain that project and what it stands for to our listeners, that would be great.
Colorado Benefits Management System is CBMS, and it is an integrated eligibility system that the state of Colorado is reprocuring. Their contract with the current vendor ends in mid-2027, and so they've got enough time to plan, and I've hired us to help them do just that. We've helped with stakeholder engagement. We've helped with an environmental scan and reaching out to states and helping understand their lessons learned. We also have done an alternatives analysis and kind of checking all the boxes for our federal partners to allow us to go forward and help with the procurement of the system.
Okay, great. Ralph, anything to add to that about the project or where we're headed?
Perhaps the logistics or the dynamics of it. The CBMS system currently serves 1.7 million Coloradans through the Medicaid program, but it's also our solution for a variety of other benefit programs like SNAP, et cetera. When you start looking at the impact that it has headed for the state overall, we know that currently coming out of the pandemic, one out of every four Coloradans is actually associated with the Medicaid operation. We're responsible for the medical services for almost half of all the babies that are born in the state. And so when we start looking at this, there's a whole technology aspect and all of those kinds of things. But the cornerstone of this is that this is part of culture and lifestyle for so many people of the state. And that puts a dramatic expectation on all of us to not only execute what we currently have today correctly, but then to envision where are we going and what does that mean over the next decade of the new system. And so the team as a whole has been working very diligently on both those aspects.
That's great. And actually that's kind of exactly where I want to go, which is to talk about the impact. So one of our core values at PK is impact. And we've really created this podcast all around it because it's really essential to our work. And for us, our definition for impact is that we approach every engagement with our energy focused on identifying the right goals, outcomes, and strategies, and that we each have a personal responsibility to make a positive impact on our projects and our world. So what I want to do is just talk first, just personally, what does impact mean to each of you in your lives and in your career? And kind of, you heard our definition, but I'm curious what your definition would be.
Well, certainly there's the numeric impact of the idea that on the Medicaid side, this system is responsible for the accurate eligibility of almost $14 billion, the largest check, if you will, that the state writes for any of the programs. It turns into 33 or 34 million provider payments that are made on an annual basis, that we're accountable not only in our fiduciary responsibility to the residents of the state and the state legislature and the governor, but because so many of those dollars are being matched out of Health and Human Services and CMS, we have an obligation to those folks from the federal government from a fiduciary standpoint. And so for me, from an impact standpoint, I'm not so much sure that it's where does the impact come from as where doesn't the impact come from, because we're expected to be able to traverse all of those different constituencies and all of the different circumstances, and then the unique individual needs of each of those members and their families. It's a high wire act without a net for sure, especially because no matter where it is, if there's any kind of a hiccup or a kerfluffle, there's folks' lives in the mix for this. And so I'm proud that I have a team in my side of the operations that feels that it's not just all those transactions and numbers. In many cases, they have family members who actually are components of the program. So they have to not only answer to me and the governor and the CMS, but they got to answer to grandma. And I promise you, grandma has the grandma I have in my mind has expectations that this thing get done right.
That's great. Act is exponential for you and for the system and for the staff. That's great. Ron, what does impact mean to you?
Ralph said when we first approached the stakeholder engagement, I guess almost a year ago, it was really eye-opening, all the stakeholders that are impacted by this system. And, the county workers who sit down and help Coloradans get benefits that they need or apply for them anyway, the beneficiaries who apply for or put the information into the system that they need the system needs to determine their eligibility, all the way to Department of Healthcare Policy and Finance folks that I work with every day. The impact is amazing, and what I hope our impact is helping them know that we're here for them, helping them know that we want things to be better and that we're partnering with them and working hard to make that happen.
So turn to the state as a whole, and you look down the road at the end of the project, and you've implemented the system and everything's working and there's all the kinks are worked out. I'm curious, what is the impact, right? What is the impact on the state and the people in it?
I think there's a number of nuances to that impact. The first of them really has to do with the governor's expectation around how do we make these programs, these services, more readily accessible and easier so that folks can really focus their lives on the things they'd really rather focus on as opposed to this. So, one of the things we've seen as we've come through the pandemic is that our PEAK application, which is our online resource, is now responsible for more than half of all the new applications that come in, and we see that continuing to grow. Our ex parte activities, which are in our renewal world, that allow us to collect data from various data sources so that we can simply send a member a notice that says, you're renewed for a year, don't bother to fill out these 14 or 40 pieces of paper. That today represents, across the entire population, right about a third. We believe coming out of the other end of the pandemic, we could be well in excess of 70% of all our renewals being handled through those services. And then the other part that's really looking at this is, as we're into, because part of our fiduciary responsibility to our state residents, like ourselves, is how are we making this better, faster, smarter, and less expensive? And so when you look at the idea that our joint interoperability team is leading an endeavor to take the workflow processes and tools that are unique to each of the 64 counties, and unify them into a single workflow tool that will allow them to share and balance work, allow us to understand value return and productivity, and ensure that, and this happens quite a bit in our world, that when a member moves across a very simple county line, that the information and the supporting documentation that's a part of their experience goes with them. So when you start looking at that, and then we're looking at integrated optical character recognition that allows machines to read these things, I'm sure AI will go along the way. What we envision is a very different experience in that if we had it our way, not only would we be able to help initiate and reinitiate these services for our members without them having to go through any owner's paperwork, but then the next natural question is, how do we use the CBMS system? And Kim Bimstuffer, the executive director of HCPF, is very, very clear on this. How do we make sure that everybody leaves with the full suite of benefits that they are entitled to? And that is beyond just the Medicaid side. That could be SNAP, that could be housing, that could be pension, that could be benefits for children. And so what we're seeing is that other state agencies are starting to talk about how can they be made a part of this. So there's an endeavor right now to bring the world of behavioral health to leverage the HCPF environment, both on the CBMS side and on our remittance side. Early childhood development is headed down this way. We're having conversations with the Department of Corrections about what does it mean if we can make sure that we've got eligibility resources available to folks when they're walking out of a correctional facility to diminish recidivism. There's a program around after-school lunches that's actually being moved to the Department of Education. So now all of a sudden, they're going to need eligibility information on who's eligible as we move towards the idea that every child should have access to lunch. So, that's the 5-minute version, or maybe it's the 8-minute version. We don't have time for the hour and 8-minute version, but it's dreaming those kinds of dreams. It's that It's that desire for perpetual improvement that we've attempted to build into our culture. And it's one of the aspects that we look for in partners, is to help us with that.
You talked about the impact on Colorado and the agency and clients and potentially your stakeholder agencies. What about providers? Is there any impact to providers with this system change?
Well, I think one of the things that we can be proud of is that the average remittance in our environment runs about 3.5 days, which everybody who's got a bill outstanding would love to get paid in 3.5 days. I think there's a number of pieces to this. One of them is that we're actually looking at whether or not we can leverage part of our tools that we're building for our behavioral health network to allow other providers to actually be part of initiating enrollment for folks on their behalf while they're in their own offices. So rather than saying, well, you'll have to go and apply for Medicaid, we already have some provider networks that are part of that, but we see an opportunity to expand that. And that certainly is going to bring an improved experience to the members and certainly build better relationship between the providers and those members.
And something that I think we're on the forefront of, and I haven't heard of a lot of states working on that. So that's pretty exciting. And I can imagine the providers being in favor of that too, not having to send them away to have them come back. Ron, it sounds like our services and support for the agency is around procurement and planning and visioning. I'm curious what you think the impact is for that work on ultimate success of the system and the procurement and kind of where we're headed and how Ralph described it.
Right. So there are several check boxes that have to be, just done because of the federal partners and just the steps that have to take place. But also in planning and looking at alternatives and working with the department and working with DHS, we also are helping to, I think, bring the best ideas forward and plan our roadmap so that the federal partners see that there is a plan in place and the different agencies can see what's going to happen. Proactive communication can happen, training and outreach. We bring the counties along so that they're involved and invested as well. So there are just no surprises when this happens and there's no disruption of services to the Coloradans and the beneficiaries. So that's really our goal.
All right. So turning to just individually for yourselves, I'm curious what impact you want to have on the world. And again, that can be personal. It doesn't need to be work related. But what kind of impact do you hope to have on the world? Ralph, do you want to start?
I had the privilege of being given the Tom Clements Award this year. It's the state's MVP. And I said to Mrs. Clements at the time, I said, not sure I've earned it, but there's tomorrow. And if I don't earn it tomorrow, there's the next day. The governor would contend that that's my cherry on top. I will agree with him when I get to feeling like I've done everything I could do to earn it. And that's still an unwritten list of opportunities.
So that drive, keep going, keep impacting and keep progressing the work ahead of you. That's great. Ron, what about you?
That's a little hard to follow.
Agreed. Good luck.
I try to bring a smile to people's faces. I try to bring value. And if I have a client that says I or we added value and it stokes my intrinsic motivation or even personally, if I've been able to add value to somebody's day, that's what floats my boat.
All right. Okay, so each quarter, our podcast has a different theme. Reliability is this quarter's theme, and reliability is defined as the probability that a product, system, or service will perform its intended function adequately for a specific period or will operate in a defined environment without failure. So when you think of the Colorado CBMS project and reliability, I'm curious first just kind of what emotions come up for you and what do you think about that?
Well, I think we both know from the meetings that we've been in that especially around our county eligibility workers, that they come to work expecting that they have a workload that surpasses the capacity of their day. And that means that they have to be productive in reviewing eligibility decisions throughout the entire day in the hopes that at the end of the day there are a few less than there were at the beginning of the day. So we've heard about standards of, what do you mean we have to talk about it being down 20 minutes a week? With total aghast in folks' voices, because they're setting such a high standard for us from a bulletproof, from a resiliency standpoint. I can still recall a call that we had where we were talking about, it was either Google or Yahoo, or we were talking about a major name brand and what their performance for uptime was. And the county workers, to a person, stopped us in the middle of the conversation and said, you don't understand. The standards that may be good enough for Google aren't good enough for us. And they weren't kidding. And it shifted the conversation around the fact that these folks want to make sure that this is no different than any other social or protective service. When you make a call for data, it's no different than when you make a call to 911. The information, the data, and the resources better be there. Because those folks out in the field, those eligibility workers, are depending upon that level of resiliency.
Ron, any emotions come for you when you think about this project and reliability?
Yeah, it really stoked some excitement. When we were interviewing the Code for America organization, we actually talked to some people who have had to navigate the system, and because of their disabilities, they actually had a really unique perspective. And Ralph has told me this many times, that we would like the digital channels and tools such as Peak to allow people who can navigate them to do so, such that the county workers can help those with special needs. And so if we can help achieve that gives me excitement.
Tell us a little bit more about Code for Work entailed. It sounds like it was dealing with actual people that are involved in the system and some human-centered feedback or design.
Yeah, they definitely into those areas, and they work with states and help them develop systems that are better designed for the human to interact with them. And we did an interview with them, with some of the directors in that group, as well as some of the people who they brought in for us to hear the ground level stories. So we did one 2-hour interview with them and learned so much. It was definitely eye-opening to talk to that group.
Ralph, so is that one of the values for this system, or something that you're driving towards, is having it be more user-friendly or user-designed?
It absolutely is. And I think Ron caught a piece of it. Number one is because we believe there's a substantial portion of our population that want to be self-actuated. They want the power to do this by themselves, and they don't, in many cases, feel like they ought to have somebody at their elbow or hold their hand or just give me a tool that I can use. But the other part of it gets back to part of your other comment, is that there's a small portion of the member population within Medicaid that have substantial challenges, traumatic brain injuries and disabilities. And for those folks, Medicaid is more than medical bills and doctor's visits. It's long-term care services and a whole host of other elements. And so part of what we envision is really a duality to the win. If we can create systems and solutions that streamline self-service, if we can create solutions and systems that streamline the eligibility agents in the counties who make decisions, then that leaves more time for those eligibility professionals in the counties to spend and invest the time on the more complex member circumstances and really focus in on what's the best way to serve, in many cases, folks that are either involved in 24/7 care operations or are having 24/7 care support provided to them in their homes, and everything in between.
Pretty exciting, actually, and having it online where someone can actually access it, like we access so many of our things in our world these days, I think would be pretty amazing. Quite a feat. I'm curious if there's any other functionality that you're dreaming of or planning on for this system that we haven't talked about yet, that you're excited about or that might be interesting, that's kind of a change from where you're at now, either of you.
I mentioned in past, and I truly believe it's going to be revolutionary because of the way Medicaid eligibility works in the state of Colorado. Local county staff have the power for eligibility decisions. I don't make those calls. They're made and conveyed based on the county Medicaid technicians. And historically, there's been this gap between the CBMS system and their innovations of how do they process document imaging? How do they track workflows? How do they make sure that they're not working out of a stack of manila folders that go into file cabinets. And so the team that's working on interoperability over the next few years really is creating a module that will dovetail into CBMS to provide that kind of unified service. And there was a great celebration in all our hearts on the day when the counties all voted that they wanted to join in on having one path through the snow, because their history has been that they each had their own path through the snow or several paths through the snow. The effectiveness and efficiency that that's going to bring to the business is huge, and it's already starting to reinforce that innovation trend. I can tell you that because I'm responsible for the Medicaid call center as well, my technicians have had more calls from counties in the last several months around what kind of call center technology is out there? What kind of tools could we be using for that? Where can we leverage? Where can we share? And so, we're at the very beginning of that pea that drops at the top of the mountain that turns into a snowball that I think has amazing results as it gathers speed and gathers dimension, whether it's in the CBMS system, whether it's in the surrounding systems, whether it's in the ancillary adjoining technologies. It's contagious. And part of our goal is really to try and find a way to make it, because change is tough for everybody. So contagious is what we're trying to create.
Yeah, and if you can make that change exciting, or they want to buy in, it's going to be a lot easier in the end when you go to put that system in place, make it live. Good. All right, well, let's move us on. So one of our aspirational values at PK is progress, which is really all about the collective power of impact. So if we're having an impact here and we're learning from that, whether that's a failure or a success, we're using that to impact the next project or the next client or the next state. And the idea is that we want each engagement to build upon the last, that's advancing towards the goal of leaving the world just a little better than when we started, and that this is the ultimate reward for generating the evidence to understand what works and what is impactful. So for me, this is all about lessons learned. So what can we take? What are our learnings, right? Whether they're failures or wins, and pass them on to future projects. So what I'm curious about is, what lessons have you learned so far in the project that you can share, that you'll take forward into your next project, or that ultimately helps the needle that another state or another agency could use to make even more progress on their projects?
I think one of the foundation ones that we have discovered is there's no such thing as too broad a constituency, no such thing as too broad an inventory of stakeholders. The project has actually, I would say it has had to some degree, has had to slow down specifically because when you bring all of those opinions and all of those insights into the room, and if you truly intend to empower them to be participating opinions, it just takes longer, if nothing else, just to listen to them, let alone then figure out how their element dovetails into somebody else's, dovetails into another. And so the idea of building requirements, there have been a number of, me and a six-pack of beer, and I could have had these requirements written in about 20 minutes and, could have been out on the slopes or something. But that's not the right way to do these things. You said the words earlier in that, we're striving to create a level of buy-in, and that buy-in sometimes means that you didn't get your way, but you were a voice in this. And that doesn't mean that you're not part of potential downstream innovations. So it's not if we value your opinion, we do. Sometimes it's the when we're going to be able to enact on your opinion that may be the nuance that we can't do everything first.
Yeah.
It's the largest technology platform in the state, to the best of my knowledge. And our first job is to simply make sure that we've satisfied the state and federal requirements for the reprocurement of it in 3 modules, 4 modules, 3 modules, 4 modules, 3 or 4 modules. But then there's so much to build beyond that. And we owe it to all those stakeholder folks to make sure they know we didn't forget about all those great ideas.
How hard has it been to build that consensus in those sessions?
One of the blessings that drew me to social services was the fact that it paid in my heart. I started this conversation with telling you it paid in the heart. Turns out when you get into things like Medicaid and SNAP and environments like that, you find other people who get paid in the heart, and in many cases, and I respect it, have been paid in the heart for multiples of the time I've been getting paid in the heart, right? I'm, a decade in this, and there are people who are many decades in it. So it really becomes almost a process without end. There is not an ability to cut off discussion. We have had many, many more meetings and interactions than I think we intended initially, because there have been that many opinions. And as long as the constituency hasn't run out of things to say, we need to be there to listen. We do have to make sure we don't have to listen the same thing for the fourth time, right? There's a little bit of efficiencies in that, but it's so important to make sure that if we polled all of the folks that have been a part of this so far, I don't know what kind of a score I'd get if we asked them, did you get your way? But I do think we get a great score if we said, do you think you were heard? Do you believe that somewhere in the downstream of all of these efforts, your thoughts and ideas and values will be re-raised as a part of it? And I hope we would get good scores for that one, knowing that not everybody can be first.
Ron, any lessons learned that you'd like to share?
Yeah, that's a great point. And I just wrote that down, consensus, because that was the lessons learned at the beginning of this project. We had everybody with differing views and differing priorities and asking us, well, when are you going to bring us to consensus? And just like you said, Ralph, that was the lessons learned that we should have addressed right then, in that is not what's going to happen. Rather, we are going to hear your concerns and address them and see how it's going to play out in the roadmap. So great lessons learned there.
Okay, so I hear engaging stakeholders and far and wide, making sure that they're heard, making sure that we know who the decision makers are and that it's not a consensus. It's not between everyone in the room. Anything else, Ralph, that you'd add?
We're better with voodoo donuts. The best meeting we had is the one where I brought 2 boxes of voodoo donuts. Everybody's mouth was full for the first part, which worked because you guys could talk. And then we had to deal with the sugar high, where everybody was kind of yippity. And then, once they got into that after lunch, so voodoo donuts, voodoo donuts, voodoo donuts.
The other part was, I think we did have a broad spectrum of stakeholders. Lessons learned that I hope we employed was making sure we heard everybody's voice, not just having them at the table, but actually engaging each of them to get the feedback that they intended to give us.
One of the other takeaways that I had from this is there is a constituency in this that really would wish we wouldn't do this project. Leave it alone, patch it around the corners. And part of that is based on a long-term familiarity for a system that's been around now for 6, 7, 8 years. Vendor partners that have been around for the same amount of time, that relationships have been built. But I think also against the backdrop that everybody who's a part of this project has at least one full-time job other than this project. And so as we started talking about the complexities of it, this issue around creating modules as opposed to a one vendor fits all type approach, which was a CMS expectation if we wanted their matching funds. The backdrop of people are so busy in government jobs that when this event comes around every decade or every 6 or 7 years in preparation for that decadal anniversary, government isn't about the idea of saying, oh, let's go out and hire 30 or 40 additional people to do this. We get a chance to find some thought partners to help keep us in line. But for the most part, we're asking people to take on 10, 20, 30 hours a week of additional work for some period of time. And we need to respect that drives some of the thought processes and some of the behaviors. It's human.
Incentivizing people to actually give that extra time and attention.
Did I mention voodoo donuts? Other than donuts. It's interesting, the coming out of private practice, if you will, or private industry, those are very natural questions. And in the state government environment, there are very few of those kinds of options that are available. So we're relying upon, and we have to make sure we're not abusing that paid in the heart piece, that there are people who want to be a part of this to points where it may very well pain them from added work hours, family life, and things like that. And one of the things as a leader in our organization that I'm finding more and more is I not only have to respect that, but I have to make sure that I don't take advantage of it. In our case, this whole reprocurement is going on while we're in the middle of unwinding, that public health emergency thing, right? We only have 1.7 million people to redetermine in the next 12 months while we're writing the RFIs and RFPs, and both of those fit into by the way, they have a real job as well as those two projects. Did I mention we're doing behavioral health, early childhood development, the fiscal, the world is reprocuring their world. It just goes on and on and on. We have to sometimes guard people from their own best angels. The hard, if you ever have somebody who dies trying, is they died. That's not a satisfactory event. So.
Yeah, I think that, one of the reasons why we wanted to start this podcast is there's a lot of unknowns in the public about what government workers do, right? Or what people that work at the government agencies. And I think the one thing that I have seen over and over again is just that heart, right? That heart and that passion, and why they're in that job almost exclusively is just that drive, right? To do good, to make an impact, to take care of the citizens of whatever state that they're working in. And you're right, that can go too far. And it's hard to rein that in, but without it, we wouldn't be getting done near what we're getting done every day. All right, well, let's, moving on is actually just a way to close us out. And the way that we're going to close us out is just a little bit of a fun game to ask you some questions and some advice to share with our listeners. So we built this podcast around one of our 3 core values, impact. But to close out every podcast, we want to ask each of our guests to share their wisdom on the other 2 core values for PK. So I just have 2 final questions for you each. I'm going to read the definitions of our other 2 core values, which are inclusion and teamwork. And then I'll give you a minute to think about your best advice for our audience on achieving both. There are no wrong answers here. It's just purely some advice and some fun before we close out. Are you ready? All right. So the definition of inclusion is that we recognize the fundamental value and strength of all individuals, and our teams create a safe space for open, inclusive, and diverse participation of all peers, clients, and ideas, and that we build high levels of trust and belonging. So with that definition in mind, what is your best advice for achieving high levels of inclusion in the workplace? And I'll let you guys decide who wants to share first.
So just say that just being mindful and intentional in making sure that you get everyone's input that's in a meeting, that's in a group, and not leaving anybody quiet. Some people try to be that person that wants to just listen, but that's how I think you do inclusion, if you will, and make sure that you're getting everybody's input and taking it seriously.
So I think after 3 years, if you were to go to any of the folks that I work with on a day-to-day basis, my 1-ups and 1 and 2-ups, because I draw this inverted work chart pyramid, I think if you asked any of them and said, what are Ralph's favorite 3 words? Because they've heard them from me daily, weekly for the last 3 years. They're always the same 3 words. And those 3 words are, I trust you. And those 3 words are both sides of a coin, right? They are an ovation of, I'm willing to back you and your knowledge and your experience, et cetera, but it also means I need to get your best, because that trust is based on what I believe to be your best, your deepest competencies applied to these things. And so those 3 words save me a lot of hours, because I don't believe in if my team's in a meeting, my first question is do I need to be here? Simply because if they've got it, they don't need me. If they need me, I need to be available 24/7, 365 to help them. But ultimately, I truly believe that the team I've been blessed to have, and we've had amazing resilience in that team over the last 3 years, I truly believe they've come to trust that I trust them. And it's now part of their decision-making and part of the culture they're applying to their own staff.
I love about that a lot at PK too, and that the trust also goes to, you're going to make mistakes, and if you make them, I got your back, and we'll figure out our way through it along the way, which I'm guessing is a part of it for you as well. There's not a lot of trust without that. So that's great. All right. Teamwork. So this one is, we do more than just work together. We respect, trust, and care for each other. And this collaboration and belonging extends to our clients as much as our colleagues. So with this definition in mind, what is your best advice for our listeners for achieving high levels of teamwork in the workplace? Ralph, do you want to start?
Sure, and it's almost voodoo donuts. I mentioned at the beginning of this that I've been blessed to be married to the same woman for 40 years. It turns out she's quite the baker. And we're having an in-person meeting next Tuesday, and I already got 3 requests that say, is Betty baking for us? There is something in our, if you look at Maslow's hierarchy, feeding people is in there. We're programmed for that, and I'm not opposed to using Maslow's hierarchy, especially when it's her yummy oatmeal craisin cookies. So it's those small courtesies that are unexpected. Baking is one of them. Out of our reserves, I'm probably one of the most prolific Starbucks gift card senders in the state of Colorado, because my wife's continually going, Betty's like, okay, tell me the story behind this person and this person and that person, because I'm sending these out of our account. The team and I are going, and they're plus ones, and Betty, because she's important to the team. We've got plans for a baseball game in September that we're going to go take a Wednesday afternoon off. We're going to go play baseball. They endure the fact that both my daughters came home from the hospital in a Cubs uniform. So it's a Cubs game, but it's also a game for us to. So it's these kinds of social interactions that, they've been guests in my home. The little gifts just continue. There was a Sunday just before the Christmas holiday where me, Whitebeard, was still in place, and my Santa hat. Betty and I dropped flowers and Fannie Mae chocolates off at the house of every one of my team, just out of the blue. Simply showed up at their house, knocked on the door, and said, this is for you for the holidays. Those kinds of very, very human touches have become, in far too many cases, deserts, if they exist at all. It's our secret sauce. It's my secret sauce. Is those kinds of touches that is almost painful for it. It isn't all the things that we do for my team so much as how infrequent those things may be happening to folks that are outside of the team. And so by comparison, but I would much rather that, like my boss does, like we do, like, other parts of the team do, we need to celebrate those folks and the folks that are behind them.
Kindnesses, small gestures, and really showing that love and caring and generosity. I love that. I'm also really jealous I didn't get any of Betty's cookies after you described them. Oatmeal raisin is my favorite. That sounds amazing. All right, Ron, what would your best advice be for building high trusting teams?
I really liked how that ended with celebrating successes, because also a little higher on Maslow's hierarchy of needs is self-actualization. And I think that just setting expectations and trusting your team and giving feedback and trusting that the feedback will be received and asking for feedback. A lot of these things are just kind of ingrained in how we do teamwork at PK. And not only celebrating successes, but also learning from things that don't go quite as well. And so that next time they can be a success.
All right. Anything else burning that you want to share before I close us out today? Nada? All right. Well, I cannot thank you both enough for your time today. It's a huge privilege for me to be able to be here with you, to connect, to learn, to grow, to breathe, and to share. Until next time, this is Stacey signing off.